Hi everyone, welcome back to another episode of Psychiatry Rewritten. My name is Lane. Some treatments take weeks, some take months, and some, like IV ketamine, can change something in hours. That's not an exaggeration. That's not marketing. That's the experience thousands of people have had when nothing else worked. For people living with treatment-resistant depression, suicidal thoughts, or deep trauma that meds and therapy haven't touched, IV ketamine can feel like a lifeline dropped into the dark. But it's also complicated. It's dissociative. It's expensive. It's misunderstood. And because of that, a lot of people still haven't heard the real story. In this episode, we're going to talk about what ketamine actually is, how it works in the brain, what it feels like, and what it doesn't do. We'll look at the science, the controversy, and the stories of people who say it gave them a reason to stay alive. This isn't about hype. It's about hope on a drip. Let's start not with the brain chemistry, but with the people who've lived it. When we talk about IV ketamine, it can start to sound a little clinical. NMDA receptors, glutamate, neuroplasticity. But for the people who have lived through it, the ones who came in feeling like nothing could help, the impact is often hard to describe. So instead of me telling you what it's like, I want to let them speak for themselves. I walked in feeling like I'd be better off dead. I walked out thinking, okay, maybe not today. And that was a win. After the second infusion, I sat in my car and cried. Not because I was sad, but because I remembered what it felt like to feel something other than despair. I didn't hallucinate. I just felt still. Like my brain finally stopped screaming at me. That peace lasted long enough for me to start EMDR, and I don't think I could have done it otherwise. It's like someone turned the volume down on my sadness. I wasn't happy, but I wasn't drowning. Ketamine didn't fix me, but it gave me enough air to try again. I felt like I had options again. Depression had stolen my ability to imagine the future. These aren't miracle stories. They're survival stories. And if you listen closely, most of them aren't even talking about joy. They're talking about relief, about possibility, about the absence of pain, even if just for a few hours. That's what IV ketamine does for some people. Not everyone, but enough that we can't afford to ignore it anymore. So what's actually happening when someone gets IV ketamine? I mean, it's not magic, but it feels like it for some people. Because while most antidepressants take 4 to 6 weeks and still leave people waiting, ketamine can shift something in hours. Ketamine is what's called an NMDA receptor antagonist. That's science speak for it blocks a certain type of glutamate receptor in the brain. And glutamate is one of our most important excitatory neurotransmitters. When that system gets disrupted, which often happens in depression, the brain kind of stalls out. Ketamine disrupts that stall. But here's where it gets wild. It doesn't just boost mood. It activates a surge in brain plasticity. That means your neurons start building new connections. It's like hitting the reboot button on parts of the brain responsible for emotion, memory, and rumination. For people in deep depression, the default mode network, the brain's internal monologue, can feel like a constant loop of shame, fear, or suicidal thoughts. Ketamine interrupts that loop. Not by numbing it, but by shifting the brain's rhythm just long enough for a pattern to break. And yes, some people dissociate. They might feel like they're floating, watching themselves from the outside, or momentarily detached from their body. But for many, that dissociation creates just enough distance from the pain to reflect on it, rather than be consumed by it. One psychiatrist I know says it like this: SSRIs plant the seeds. Ketamine clears the storm so they have a chance to grow. It's not permanent. It's not a miracle. But it can create a window. And in that window, people can start to breathe again. And here's the part most people miss. Ketamine isn't always the treatment. Sometimes it's the thing that makes treatment finally possible. So, let's talk about who IV ketamine actually helps. Because despite how powerful it can be, it's not for everyone. and it doesn't work for everyone. It's been most studied and most effective for people with treatment-resistant depression, meaning they've already tried multiple antidepressants, maybe therapy, maybe even hospitalization, and nothing touched the core of it. In that group, up to 70% respond to ketamine in some way. That doesn't always mean full remission, but it might mean suicidal thoughts go quiet, or emotional numbness lifts, or someone says, I think I want to stay alive now. It's also been used with promising results in bipolar depression during the depressive phase, not the manic phase, PTSD, acute suicidality, and increasingly in people with trauma-related dissociation where traditional medications don't help. But here's where it gets tricky. Ketamine isn't a miracle. And it's definitely not for every diagnosis. It's not recommended for people with a history of psychosis or schizophrenia, uncontrolled substance use, especially if ketamine itself has been misused recreationally, and unstable mania or severe agitation. There's also a real access problem. IV ketamine isn't usually covered by insurance and can cost from $400 to $800 per infusion. Most people need several infusions to feel an effect, and some need maintenance dosing every few weeks. And here's the truth clinicians don't always say out loud. Some people just don't respond. No dissociation, no shift, no breakthrough. And when someone's pinned all their hope on it, that can be devastating. That's why informed consent really matters here. People deserve to know what it might do and what it might not. But when it does work, it often gives people their first real shot at healing, not because it fixes everything, but because it helps them stay long enough to start. Okay, let's talk about neuroplasticity, because this is the part that matters most, and the part most people don't fully understand. Most traditional antidepressants work by increasing serotonin levels, but they don't necessarily help the brain change. They adjust the chemicals, not the wiring. Ketamine? It goes deeper. It actually helps your brain build new connections. So, what is neuroplasticity? Neuroplasticity is your brain's ability to grow, adapt, and change, even in adulthood. Think of your brain like a garden. Depression doesn't just mess with the weather. It wrecks the soil. It shrinks parts of the brain like the hippocampus, which regulates mood and memory, and it weakens the connections between neurons. That's why people in deep depression often say, I can't think clearly. Everything feels slow. It's like I'm stuck in a fog I can't get out of. The soil is depleted. Nothing's growing. The old pathways are dying off and no new ones are forming. And this is where ketamine comes in. Ketamine triggers a surge in glutamate, which is the brain's most powerful excitatory neurotransmitter. That glutamate flood activates BDNF, brain-derived neurotrophic factor. BDNF is like Miracle-Gro for your brain and for your neurons. Within hours of an infusion, the brain starts sprouting new synaptic connections, repairing old damaged pathways, and strengthening communication between areas involved in emotion, memory, and self-awareness. So it's not just symptom relief, it's literal structural healing. One study showed that ketamine increased spine density in the prefrontal cortex, which had been eroded by chronic stress and depression. Spines, by the way, are the little arms that neurons use to talk to each other. Another study showed that depressed mice treated with ketamine regrew neural connections within 24 hours. That's unheard of with standard antidepressants. So, what does this mean in real life? It means people stop looping. They stop reliving the same thoughts, memories, or shame spirals over and over because the loop gets interrupted. New options appear. That's why someone can say, I still had problems, but they didn't feel permanent anymore. And yes, psilocybin, the compound found in mushrooms, magic mushrooms, shrooms, does something similar. In fact, both ketamine and psilocybin are part of a group of treatments being called psychoplastogens. That means they increase neuroplasticity in ways that are fast, intense, and therapeutic, without needing months of daily use. Traditional meds manage symptoms. These reshape circuits. And the most exciting part, when neuroplasticity is high, therapy works better. That's the moment when the brain is most open to rewiring patterns, beliefs, and trauma responses. Ketamine doesn't just lift mood, it repairs the brain's wiring. It boosts glutamate, activates BDNF, and triggers synaptogenesis. That creates a window of brain flexibility when change is possible. That's why therapy right after ketamine is so powerful. And it's why ketamine might help where everything else hasn't, because it works differently. Ketamine didn't just change my mood. It changed my brain's ability to change itself. All right, time to bust some myths. Because when people hear ketamine, they tend to picture one of two things. One, a horse tranquilizer. Two, a party drug from a rave scene. And technically, they're not wrong. Ketamine is used in veterinary medicine, and yes, people do abuse it recreationally. But when it's given at a controlled dose in a medical setting with psychiatric supervision, it's not a tranquilizer. It's not addictive for most people. And it's not an escape hatch into euphoria. Myth number 1, ketamine is just a club drug. The dose used in psychiatry is a fraction of the street dose. It's administered slowly through an IV and monitored the entire time. This is not a glow stick and dance floor situation. This is lying in a recliner, in silence, sometimes crying, sometimes just breathing for the first time in weeks. Myth number 2, it's addictive. The truth is, in medical settings, the risk of addiction is very low. Ketamine doesn't activate the same classic reward circuits as opioids or stimulants, especially at therapeutic doses. For most patients, there's no compulsion to chase it. They're not seeking a high. They're seeking relief. Myth number 3, if you feel dissociation, that means something's wrong. The truth is the dissociative effect is part of how ketamine works. For some, it helps create enough emotional distance from trauma or pain to start processing it. Others feel very little. Both responses are normal. Dissociation isn't always dangerous. Sometimes it's a doorway. Myth number 4, it cures depression. The truth is that no. Ketamine is a catalyst, not a cure. Its effects can wear off, and they often do. That's why integration with therapy, support, and lifestyle change matters so much. It gives people momentum, but healing still requires effort. The bottom line, ketamine isn't magic, but it is medicine, and it deserves to be treated that way. A 2022 meta-analysis found that up to 70% of patients with treatment-resistant depression had a measurable clinical response to IV ketamine after just 1 to 2 infusions. In a 2019 Yale study, suicidal ideation dropped within 4 hours post-infusion in nearly half of all the patients that they studied. Neuroimaging shows that ketamine increases synaptogenesis, which is the growth of new neural connections, particularly in the prefrontal cortex and hippocampus, which are areas that are often impaired in depression. When paired with therapy, especially EMDR, IFS, or somatic approaches, patients report higher retention of progress after ketamine sessions. One study even showed that ketamine responders had fewer ER visits and hospitalizations in the 6 months following treatment. When a patient tells me they've tried everything, I ask if they've tried ketamine. Not because it's trendy, but because I've seen it pull people back from the edge when nothing else worked. It's not about getting high. It's about getting a chance. IV ketamine might open the door, but what happens next, that's where the real work begins. For some people, ketamine is the first time they've felt any kind of mental relief in years. But just like a breath doesn't fix drowning, it buys you time to swim. Ketamine isn't the solution. It's the reset. And that reset only really matters if it's followed by something meaningful that helps you rebuild. So what does that actually look like? Well, again, therapy. And not just talk therapy. Some of the most powerful gains from ketamine come when it's paired with trauma-informed therapy. That could mean EMDR, which is eye movement, desensitization, and reprocessing. IFS, which is internal family systems. Somatic experiencing. Or just a therapist who knows how to help someone navigate a post-dissociative experience without pathologizing it. The brain is flexible right after an infusion. There's this strange little window where things feel clearer, memories feel more accessible, and defenses are a little softer. That's the moment to start the deeper work. Number 2, reflection and writing. A lot of people journal after infusions, sometimes during. What came up? What felt different? Did anything shift? Because those insights are easy to forget once your brain starts slipping back into its old patterns. Integration means holding on to what was different so you can keep learning from it. Number 3, community and regulation. Coming out of a ketamine experience can feel disorienting, even if it was peaceful. It helps to have someone there who gets it, whether that's a provider, a support group, or just one safe person to say, hey, I'm still me, but something moved, and I'm trying to make sense of it. Number 4, maintenance plans. Some people need just a few infusions. Others benefit from regular booster doses every few weeks or months. There's no one-size-fits-all formula. But what does help is having a plan, one that includes therapy, movement, nutrition, sleep, and connection. Ketamine might give you the light, but you still have to walk through the room. And integration is how we keep that light from fading. Only 30 to 40% of patients achieve remission from first-line antidepressants. 1 in 5 people with major depression experience suicidal thoughts. IV ketamine shows significant effects within 1 to 2 infusions, compared to 4 to 6 weeks for SSRIs. About 1 in 3 patients show response after a single infusion. Even partial improvement can be life-saving. And patients often describe ketamine as giving them a window of relief lasting 3 to 14 days without maintenance. Up to 70% of treatment-resistant patients respond to IV ketamine. For some, suicidal thoughts drop within 4 hours of the first infusion. New brain connections start forming within 24 hours in animal studies. And follow-up data shows fewer hospitalizations, fewer ER visits, and more people saying, "I'm still here because of this." That's not hype. That's data. And it's changing how we think about treatment. Ketamine isn't for everyone. It doesn't work for everyone. But for the ones it does help, it's not subtle. It's the silence after years of mental noise. It's the first deep breath after thinking there were none left. It's not a miracle, but it's a moment, a window. And in that window, therapy might finally work. A conversation might finally land. A person who thought they were out of options might finally say, "I want to stay." We owe it to those people and to ourselves to take this seriously, to get past the stigma, the club drug headlines, and the fear of doing something new. Because the truth is, this isn't new. We just stopped listening to what it could do. So whether you're a clinician, a patient, or just someone trying to understand this better, I hope you remember this. The point isn't ketamine. The point is healing. And for some people, ketamine is the first step toward believing it's possible. Thanks for listening to this episode of Psychiatry Rewritten. I'm Lane, and I'll see you next time.